Excellent. Hi, everybody. Thank you so much for joining us. This is a topic that we're all really excited about. So we're going to go ahead and start just by introducing ourselves. Liz, I'll start with you.
Well, good afternoon. Happy to be here. My name is Elizabeth Perez. I am the Chief of Public Affairs and Equity at the Washington State Department of Health. I come from a wide variety of public sector. I actually originally got started in healthcare. But I have worked at all layers of government, federal, state, local, and I run a lot, and have throughout my career run a lot of public initiative campaigns and a lot of policy programs to improve health and well-being for the nation.
And I'm Betsy Baker. I am our public health transformation leader at Amazon Web Services. I know firsthand what it's like to have the burden put on you in government assistance programs. And so I've spent the last 10 years of my career trying to use technology in order to transform that constituent experience in government programs so that we can make it a little bit easier on folks that are already burdened.
And I'm Abby Koss. I lead content for our state and local government and education teams at AWS. My background is in government service redesign. I've designed services across the US and the UK, sort of most notably co-led initial COVID response for 5 agencies in the White House. So let's go ahead and get started. And I want to start out with a picture. Doesn't look like we have a picture up, does it? There it is.
No, we do.
Excellent. Now we do. All right, so Liz, can you tell us about what this picture is?
So I'll start with a story, and we're going to go back in time. And not to rehash the trauma of what we've lived through the pandemic, but starting from when the pandemic happened, I think Washington State, what we did is we created what's called the vaccine, really public-private partnerships around working on how do we work as a team around COVID-19. And so it had a wide variety of partners. It had a lot of tech partners, everyone from AWS, Amazon, Microsoft, Uber, Lyft, Alaska Airlines, Starbucks. We all came to the table and we said, how are we going to work together as a state and really help improve and handle this pandemic? So one of the things that happened as public health, as we're trying to roll through and get a handle of the pandemic, we started to look at how are we going to really pass and get vaccination to 8 million people. And one of the things that was happening was there was a group of retired librarians who were Googling all the internet, and they were curating a list of where people can get vaccinated. And it got really, really popular on Facebook. And what they did is people would ask them, where can I find a vaccine? And they would Google all day long. So what we did, and they started to share that with us. So what we did is how do we actually operationalize this and turn this into a tech option? So that is how we created the vaccine locator. And one of the things when we create, we have to think about, at least for us in public health, does this meet the needs of just not one person, but everybody? And so we had a vaccine locator, we had a chat box, and we had a call center. And this letter came through of a 70-year-old woman who wasn't going to use a chat box, was not going to use a vaccine locator, but called the call center. And Hannah, who answered that call, walked her through a vaccine appointment, got her appointment, and arranged for an Uber to take her there and take her back home. And a symbol of what we do when we do technology and the things that we create is she went home and she wrote this letter and she mailed it. And so for us to sit back and think about, yes, we all have options to create stuff, but it is our role, and a lot of my role is whatever we create, ensuring that no one gets left behind. And so this is a letter of someone's grandma, someone's mother, someone's aunt, sister, who actually cried, and Hannah was the person that got her what she needed.
I love that.
So that's one example of what's possible when public-private partnerships come together to do work that really matters, that has a huge impact. And so over the next chunk of time, we'll be going through this in a little bit more detail. There are challenges to doing this work, everything from figuring out where to start, to figuring out the right things to do, to figuring out how to get somebody to let you do it. So we're gonna highlight some of those things and then share examples of ways that we've seen this happen, both within Washington and with AWS, and then also more broadly, as we've seen across our careers or across just the landscape of people doing this work. And we want to leave folks with something actionable to walk away with. What is the thing that you could do today, tomorrow, next week, to start thinking about or exploring this work, whether it's day one for how you're tackling this, or if you have a mature practice but you're looking for new things to do. We'll also have time for questions at the end. So to start off, why is this the right time, the right space, the right room to have this conversation? Why are we here at reInvent in 2023 talking about this work? And Betsy, I'll start with you.
Sure. So, like I said, I've been in technology and government assistance programs for over a decade, and for a long time, equity was a buzzword. It was something that you would say, we want to make things more equitable, we want to make healthcare more equitable, we want to make food more equitable, and that's kind of where it ended. I think the pandemic did a lot of things, and I certainly don't want to harp on them during this talk, but I will say, obviously, it was a very impactful time. And one of the things that it did impact was the ability to take equity from a buzzword into action, and seeing grassroots groups really pull together. And we heard stories of people who would go grocery shop for immunocompromised, and so we kind of took equity, the buzzword, and started to see more and more people, including private enterprise, think about the small thing that they could do in order to make things a little bit more equitable, whether that's within their company or across the space that they work in, and in my work in government assistance.
The thing for me is that, so this is the biggest event that I've ever been to in my whole life. Like, this is the definition of scale and what it means to work at scale. And so if we are going to be in front of what is, I believe, like 10 billion people, let's talk about what it means to do things really big, to take what the government has in terms of its great breadth and depth, to take what the private sector has with its great breadth and depth, and do as much good as we can with it. And I know, Liz, you've got some thoughts on equity and just builders here too.
Yeah, I think, so what we learned through the pandemic is it brought out the goodness and it brought out the badness, right? We've seen that kind of play out. But I do think when we talk about equity, it's a misunderstood term, right? People think it's just, and it is around racial, ethnic groups. But there's the and it means like people who live in rural areas. And it means people who geographically are away from healthcare services, and it means disability groups, and it means like people who are living below a poverty line. So there's a lot of and so for me, and what we do is we just want everyone to have the same opportunity of good health. It doesn't matter where you live. It doesn't matter what your economic status is. It doesn't matter what your education is. It doesn't matter. We just want everyone to have access of good health care. And what we do is where you go to a doctor and that's very micro, it's a very microcosm of you see a doctor, you get a prescription, you get treated for that one thing. What we do in public health is we do population scale, right? So we look as an entire neighborhood and community is what we would call as the patient. So for us, it's how do we work not just one person to one person, but how do we work across the system? And I would actually argue that it's always the right time to do the right thing.
I love that. All right, so then why here, why now? Why is this work worth doing? Why should we take the time to invest in this kind of thought, labor, experience? Liz?
I'm going to say we're friends.
We are.
So I have been in public sector and I've been in healthcare. And I'll be very candid with you. If you think that government's going to solve these issues alone, you are mistaken, my friends. Like, we're just not going to do it. And there's no way that we are going to be able to solve them on our own, because it does take everybody coming together to solve these issues, because these issues are very complex. And as leaders, as builders, in everything you do, what we like to do, even in policy, is we like to look at one track, very linear. There's homelessness, let's build houses. You know, we want to do that one thing, but what we've learned and what we know is that these issues are multifaceted and very complex. And so it's just not one solution, one thing. It is going to take a lot of bits and pieces and everyone working together to put this puzzle together for a solution. So the reality for me, and I think what we've also learned, is we have, you know, as a public health agency, we have a really good, you know, we are really good at the things that we know. But I cannot tell you, I could tell you the blind spots, right? When we're building a vaccine locator and scaling up a call center, I could tell you somewhere there's going to be a blind spot. That's my job. Think of holistically, where's the blind spot. But then I don't know what that answer is, right? So that's where the private sector and all the skills and knowledge you know and the builders come to me and say, well, this is how I can help you fix or plug in that blind spot. So I think this is the perfect time as we start to think and scale and you start to think of building new things, is what are we doing holistically together to really solve some of these challenges?
One of the things that, it's funny, it doesn't get talked about a ton, but one of the big impacts that I've seen this kind of work have is on individuals, on teams, right? It's what draws a lot of people to the public sector, or to nonprofits, or to mission-driven private sector work. We have a partner that we work with who, we did a case study with them, and they had done their first ever project with, it was a child welfare system, right? And the story ended up being about how it changed the way that they thought about their work. They were kinder to one another. They paid more attention to the customer. I went into this call with this man who was very like, I'm a partner at a partner, and I'm very like, I'm gonna tell you what I'm gonna tell you. And he ended it by saying that this was the only project he'd ever worked on that had ever meant anything to him. Mm-hmm. And so it doesn't have to be the work of a career to do equity work. You can be in the organizations that you want to be in. You can be in the spaces that you want to be in and find those one or two things, which I think is incredible, the change that it makes on you as a person.
Yeah. I mean, it is one of the feedbacks that we heard as we convened all the private sector, and the CEOs would come in and said, you know, my employees, they felt like they felt really, really tied to this effort, right? Because it was impacting everyone. And the reality is these social issues do impact everyone. It's not the person down the street, like everyone is being affected by, or knows someone with homelessness, or we talk about opioids and fentanyl, they are things that at some point, 3 degrees of separation, you're gonna know someone, or it's affecting someone across a wide variety of geographics and age groups. And so, yeah, you're right. It feels like we're doing things that really make a difference in people's lives.
Yeah. Betsy, are you willing to talk about sort of some of your experiences working on these projects?
Absolutely. So I think, you know, again, with some firsthand experience and then working in government for a long time, either in government or with private enterprise, I think we'll just give Betsy an EBT card and she'll figure it out. Or we'll give her some coupons and she'll get to the store and know what to do and it'll be fine. Or, you know, we'll give her the website to Medicaid and she'll work through it. And, you know, I don't know if anyone's ever called their energy company. You get a phone number, and it's pretty frustrating to talk to Xcel Energy, right? Hopefully not anymore with advanced contact centers, but you get my point. we have this notion that we're going to just give someone something and then they'll know what to do and work through these very complex programs on their own. And that's just not the case, especially when you consider that they may be dealing with also being a caretaker or a single mother or, working 3 jobs. And so for me, the important part of these programs are meeting people exactly where they are. And I am Amazonian through and through. I push our working backwards process on anyone who will listen, because it really does. It puts someone who is a human at the center of everything we're doing, and why we're doing it, and you build for that person. I've run over 24 working backwards sessions with government agencies, including Liz and team, and have seen the really incredible mindset shift to, okay, how can we really help Betsy and the constraints that we have by partnering with private enterprise in order to capitalize on all of our strengths collectively.
All right, so let's talk about what makes this kind of work difficult. This is not easy, so what are the things that get in the way of doing this or doing it well? Betsy, start with you.
I mean, as someone who has worked across the nation as a consultant in the past, funding and political will are 2 big barriers that tend to always get in the way, especially in public health. I don't know how many folks are familiar with the way public health is funded, but it's very siloed and it's very specific, and it's difficult to think big in an atmosphere for which you are granted something to be funded very small, not only in dollar amount, but in scope. And then, of course, you add the complexity of having governor changes or secretary changes. And so that whole leadership direction, I've literally been in the middle of a project and leadership changes and we're not there anymore. And so you have this, unstable environment that you're operating in, and then also very risk averse. And so it becomes very challenging, because how do you motivate people when you have lots of, starts and fits and starts and stops? And I know Liz will talk a little bit later about how many no's that you get. But that's all to say, it's still very important work. And you still have a lot of people doing it, but it is not for the weary-hearted, no.
Yeah. Well, tell me about the no's.
Which part? So to step back, and I think people, just because we did talk about vaccines, I think I don't know if people understand enough about what public health is. It is, yes, all the stuff around pandemics, but I also think, we are and people traditionally don't think about us, but we are first responders. Like when there are extreme weather events, when there are mass incidents of violence, we are called to be there as a first responder. And so I've done a lot of emergencies. I don't know if anyone, like Hurricane Harvey, been through that. That was, a lot of infectious disease, the Zika, the measles, the petrochemical fires. I've done a lot of gamut of emergencies. And it is all the other issues that happen that all will intersect at one point or another, directly or indirectly, around health. So it is homelessness, it is opioids, it is ensuring people have access to healthy nutrition, despite what people think. Like, the number 1 cause of cancer is not smoking, it is actually diet. So it's aging population, social isolation, it's mental health. And so we have our hand into all these things, very complex issues. And we are one sector of one group of tackling all these issues at one time, which is very exhausting and really cumbersome and very challenging, right? There is not just one solution, but these are multifactorial issues that will manifest themselves. So yeah, I get told no a lot because there's not enough bandwidth to do anything. Like I could spend my whole career trying to address the opioid epidemic, and I could spend my whole career trying to work on homelessness, right? I can spend my whole career working on mental health. And these are things that are bubbling up in it doesn't matter what socioeconomic status, it doesn't matter where you live. These are bubbling up everywhere. And so you're always, part of the challenge is you're trying to plug here, you're trying to plug here, you're trying to hear, oh, and by the way, we're just gonna have this national flood, and then, oh, there's this hurricane, and now there's an earthquake. So you're just like plugging. At some point, it's challenging of how to focus, right? And so it is very taxing, it is very emotional work. And so part of the challenge is really just really mentally and emotionally being able to do the work. So I get told no a lot. I have lots of great ideas, but then there's like, I want to solve the world's issues. I went into public sector because I want to solve the world. I'm going to make the world a better place. So, but there's just not enough resources that are allocated to do that type of work, right? So I get told no, but then I will find someone else to tell me yes. That's just how my brain has worked, right? And I've learned this, through I just have to be very strategic of how I do this. But you do get told no, not because there's not enough. There's just not enough bandwidth to go around.
Right.
I was just laughing about a story from last week when we were together, and you were like, I gave this idea to my boss, and I don't know if he thought that it was just another one of my harebrained ideas or that I really meant it.
But I'm going to find a way to do it.
We're going to do it.
The thing that I'll add to this, I'll play devil's advocate to what I said before. The vibes are the most satisfying part. The vibes are the most dangerous part. Like, there is so much work that feels like doing the right thing and is actively deleterious, that wastes time and money, that does not give people what they need. And so one of the things that can make advancing equity hard is thinking that you know the answer without doing the work or having the understanding of what it is that people really, really need. So, yeah.
And I might add, the answer in Jackson, Mississippi is going to be different than the answer in Denver, Colorado, even for a similar set of demographics. Just plus one to what you said.
Okay, so how then can working together across the private and public sector help mitigate some of those things?
Well, I'll start with a story. I like stories.
And we're friends.
And we're friends now. So I tell this story around, it's an indigenous story that comes from pretty popular in Latin America. And it is about this jaguar who's walking in the jungle. And it's a very vast, very lush jungle, and he's kind of walking through. And at the very far distance, very far away, he sees smoke and the fire. But it's so far away, he's just like, that's happening over there, and I'm safe over here. And he goes about his time, keeps going through. Then he notices, like, there's this hummingbird. And the hummingbird is, like, zipping back and forth, back and forth, back and forth. And at first he didn't pay any much attention to it. And then after a while, he was like, what is this hummingbird doing? And the hummingbird, with its little wings flapping and its long, thin beak, is going to the river and grabbing water and then going to the fire. And he's going back and forth and back and forth. And for a while, this jaguar is just sitting with an amusement, just like, this guy, what is this bird doing? Finally, he goes to the hummingbird, and he was just like, what are you doing? Surely you don't think that you're going to put out that fire. And the hummingbird says, no, but I'm doing my part. So I say that to say, we all have a part, right? These are not issues and that are just going to happen over there, and the answer is over here. And I'm going to go about my life thinking over here is going to solve it. So to the answer, or to your question, is we all have a role and a part, right? We all are fabric of how we shape the society and the world that we want to live in. And one of the things that I do appreciate about Indigenous culture is they don't think right here, right now, me and my proximity, because we like to think in the proximity of where I am, but they think of what they call the 7 generations. What is the impact of what I'm doing 7 generations from now? And so we all have a role around this. We all have a part to play. And I go back to what I said earlier. If you think that we're going to solve this issue on our own, my friends, you are mistaken. It's probably going to get worse. And there, at some point, we have to come together and figure out where do we have these strengths and where do we work together to solve these issues, to shape the society that we want to live in.
Excellent. Betsy, I'll ask you specifically about technology, right?
Sure.
How can the resources that we have as AWS or a tech company or anybody who has access to the skills, the cache, the bandwidth, what kind of an impact does that have?
I mean, honestly, speed to impact and speed to failure. I've been in technology a long time. I remember a project specifically where we tried for a year to get data integrated into a traditional enterprise data warehouse. And when I left, it still wasn't integrated, so that tells you how that went. And when I think about, like, one of the intriguing parts to me about coming to AWS and the impact that I can have, even as a single human, a single hummingbird, is that speed to value. So we can try something and see if it works and beta test it and get out in the world. And, I encourage this with folks like Liz and anyone I talk to of, like, let's just see if it works. If it doesn't, let's shut it down and move on. We failed fast and now learned a lot of things, hopefully. And it didn't cost us a lot of money because we don't want to waste the taxpayer dollars. But if it does work, then we can build fast too. So we can, start with a firework and keep that going, hopefully, with pretty minimal risk, pretty minimal cost. But hopefully, a whole lot of data, whether it's, hey, that didn't work, try again, or I think we got something here. Let's keep going.
So it's not just tech, it's also the ways that we can learn from each other's ways of working too, And I set you up there. I was like, talk about tech. And then I was like, oh, Betsy.
Wouldn't expect any less, Abby.
But, and this sort of leads into the next question to dive a little deeper into the way that AWS and Amazon and Washington work together. But there are so many ways that we can learn from each other's ways of working and the opportunities that we have. And one of the big assets that Amazon has is our distribution network. Mm-hmm. So I'm going to ask you both to talk a little bit about the work that you did together, starting with the example around COVID.
Yeah, so when we created the VAX, right, and there's actually a white paper on the Duke Margolis site about private and public partnerships as a blueprint. But when we started that, we started with originally around this call center, mm-hmm. right? So when we were looking at options to help people, it was a call center and how we scale up a call center. It was also the chat. We did the chat so that people, and it was translated in 32 different languages that my team helped worked on to make sure it was culturally and linguistically appropriate, make sure it was plain language, making sure it was all those things so that anyone could really understand and get the information they need. So we worked on the chat box. And then we started to do, I don't know if anyone remembers this, but it was the Say Yes to COVID test. And this is the time.
Depends on what state they live in.
Yes. Well, it was for us, it was Say Yes to. But it was during the time when nobody can get a COVID test because the federal government had bought them all. I hope no one is here from the feds, but they had bought all this COVID tests, and I think it was Omicron surge, like there was nobody can get a test. Mm-hmm. So what we did is we said, hey, we had this small little pilot that we got a grant funding from NIH, and it was around getting access to tests in areas that had high burden of disease. And if you don't know anything about Washington State, we are a state that has probably, well, we don't have enough healthcare, we don't have enough hospitals for the population that we have. So it is always tricky anytime we get into respiratory season because we run really high surge at all our healthcare settings, and it's really iffy, right? So we have to, you don't want to ever get in a place where you have to decide who gets a hospital bed. So every year we run really high around respiratory season, just because we don't have enough hospitals in the state. So we started saying that pilot ended with NIH around testing, and we said, hey, what if we could make this available to anybody?
What if we could get it to people's doorsteps?
What if we can get it to people's doorsteps the next day? And what we did is we worked on the back end to create Say Yes to COVID test, Say Yes to, and then what it is, it came in an Amazon box, which was anonymous the next day. And I'm going to say that the next day was so important because the federal government, theirs took 2 weeks. But ours came, and it was like if people felt sick, they got it the next day, and it came and nobody knew that you were, sick. It was a regular Amazon box. So that was the other thing that we worked on COVID. And then we have a lot of other things that we're trying to do opioids and phenols. We do work around climate. We are working with Amazon around climate. So there's just a lot of things that have really came from the relationships that we had because we are also customer obsessed.
Yeah. By far, one of the most constituent-obsessed states that I've worked with. And it's so interesting because that Say Yes COVID test, you go on Yelp and you see all these reviews and, bless the people who actually give good reviews, right? Because no one does. Me included. I'm bashing myself. But we actually talked to the Secretary of State and he was getting tweets. They're still called tweets, right?
They're sure.
They're tweets from constituents to his Twitter account thanking him for getting them a COVID test. That's pretty great. That's a success. And then we kind of went down the path of, could we do this with food, maybe?
Yeah. And
could we start to think about, what else can we bring to constituents' doorsteps in a meaningful way that can have impact? And so we started looking at our distribution centers in the state. We worked with the USDA on becoming a SNAP vendor. There was a lot of work on the back end, technically, on the Amazon Fresh side. And we ended up spinning up a program with Washington State where they were able to use dollars for Double Up Food Bucks, which is a program from the USDA that provides constituents on SNAP an extra amount of money for every $1 you spend on fruits and vegetables that don't have added sugar. And so we came up with a similar program for which Washingtonians could go onto Amazon Fresh, fill their basket, use their SNAP EBT card, and then get credits, if you will, into their Amazon wallet for any fruits and vegetables that they bought. And so, and as Liz said, we spitball other ideas all the time. But this is where, going back to what Liz said earlier about identifying the gaps, where do we fill the gaps? Where are we really strong in something and really not strong in another thing? And I gotta tell you, Amazon's pretty strong at distributing things to people. So how can we leverage that in the public sector space generally for the good and for meeting people exactly where they are?
And that came about so uniquely, and this is where it goes back to relationships. So that happened because I was at a fulfillment center looking at all the technology they have in a fulfillment center. And one of the leaders goes, hey, Liz, I have a team in DC who's really interested in addressing nutrition insecurity. Is this something that you would is this something you do, something you're interested in? And I was like, of course. And I kind of gave him the science behind it, why it's important. And he's like, well, can I connect you to? And I said, sure. So we had a call, and it was around Food RX, right? Food as prescription. Mm-hmm. And we did share, this is what we do around this work. And I think it was still in the early development of how do we actually, it was more of a concept that Amazon was still toying with. And so we that probably took over a year. Like, we went through concepts and then eventually landed about, well, let's do a SNAP. And the SNAP was, also a process of getting, like you said, USDA. How do we address food insecurity, and how do we make it accessible for individuals? So widely popular, right? People who either are immunocompromised or just don't have access to transportation can go online, order food, and it comes in their house the next day. And then they get a match of $10 now. Mm-hmm. So
that's great.
Yeah, so part of it is you use the SNAP dollars, and then the next time you get a $10 benefit extra to use on fresh fruits and vegetables.
One of the things that, when I think of equity, so I'm passionate about disability design. Mm-hmm. And one of the things that is true of if you are disabled, most of the aids, the accessibility aids that you have, they suck, they're ugly, they're unattractive, they're gray, they're sad, they are sick. They make you look and feel sick. And to me, a big part of equity, and I hear it in these stories too, is that a good experience should never be limited to those who can afford to pay a premium for it, right? That test came in an Amazon box. It didn't come in a biohazard box. It didn't come in something that's covered in stamps from the government saying that this is a government program. Amazon Fresh is really nice to use.
Yeah.
You didn't have to go to the grocery store when you are sick or drive 20 minutes out of town to be somewhere that's outside of your food desert. You can use the same high quality experience as people who are paying just with the cash out of their wallet. And that's one of the most powerful things. And honestly, it's the reason why Betsy and I still have jobs.
Yeah, and we worked with how do we scale that website? How do we make it accessible? How do we make it to work for individuals who are utilizing the program? But you're right, we've heard people who might work 2-3 jobs. I have to take a bus ride for 45 minutes to go to the grocery store. So for them, this makes a world of a difference, and it's super popular. It is, and we were the first in Washington that we were let's pilot this together, and so we became the first to do around food insecurity, to do the SNAP program where you got food to your house the next day.
I also want to add the social impact that something like this has. So picture this. You're in college, you're on benefits, and you don't have a car, so you catch a ride to the grocery store with your friends, and you pull out your EBT card to pay. You are othered if something does not go perfectly with that. Well, online, you're not othered at all. If something doesn't go right, it's perfectly anonymous. You are exactly the same as everyone else in the internet's eyes, and certainly when they show up at your door, the Amazon Fresh bags look exactly the same. So you now become a part of that social fabric that you don't have to be an other. You can just be someone using a credit card online to eat healthy food and get it delivered to your door.
And it affects, we have a lot of individuals who use SNAP, and we even have individuals who are in the military who use SNAP. So it is a program that does serve a wide variety of populations.
Oh, and to clarify, when we say SNAP, so the Supplemental Nutritional Assistance Program, it's a term. It used to refer to food stamps, and so it's cash assistance for people to get food. So tell us about the outcomes of this. What was the outcome? What was the impact? How many people were served? What kind of a difference did it make?
It was incredible. So we talked about social media, which anytime you get fanned on social media, that's a big deal, because we're more likely to say negative things on social media. So, but if we talked about say yes to COVID tests, we did 15 million tests. And it went to 1 million households, and we have estimated about 3 million households in Washington State.
Yeah, 1 out of every 3 families.
1 out of 3
in
families
Washington State
that.
got a COVID test through this program.
And when we talk about the SNAP program, so it took us a while. We got that off the ground. From January to September, we had, out of SNAP dollars, we had utilized $2.5 million. And we estimate that we're probably going to hit about $4.5 million by the end of this year. In 2022, we foresee that it's going to be at 1.8 million people, like dollars more than what we did last year. So what that's telling me is that people need it, and people like the accessibility of demand. So there's a higher utilization rate around when we do delivery around SNAP.
Yeah. And does that translate to, like, if you are 1.8 million over last year, does that mean that $1.8 million of fruits and vegetables more are in people's fridges or on people's counters?
Yeah, that's what it means. And now, I'm like, okay, how do we do food security across the state? Like, not just like, how do we do this, but how do we scale this so that it's everywhere, right? How do I deliver in rural areas? How do I deliver where there's no grocery store? Or, maybe, the Walmart is the grocery store. Like, how do I scale to do these things across so then we really address food insecurity as a whole?
All right, so we promised that we would do things that people can take away, right? What you can do. So let's start strategically, big picture. If somebody is going to do work like this, what do they need to know in order to get it right? I'll start, Betsy.
Yeah.
Go for it.
So the thing that's so wonderful about the culture that I'm a part of now here at AWS is we have a think big culture. And what that means to me is to think transformationally instead of transactionally. So I do a lot of, and we even did a little bit of this last night, what if we could do X? What if we could deliver, have telehealth and then deliver supplies to that person, using a distribution model? What if? And so you really dream big, and think transformationally versus thinking transactionally, which is what I'm used to, working in not only tech, but certainly in government tech, is, this piece of code doesn't work for this, or we have to add this new thing for this new program. Let's just we'll just add that on there, we'll put it into the change order, and 6 weeks down the line, we'll figure out how to do that. So really changing that mindset to the transformational thinking, and then where do you start? And for me, how to determine where to start is who is your customer? I always relate to, I used to do a lot of work in the state of Hawaii. I obviously look very different than a lot of Hawaiians do. And, before I would spend a lot of time there, I did a lot of research on the culture of the island, on some of the history. This is going to sound kitschy, but I don't mean it to at all. I know that spam is like a big thing there, and so, I tried to make spam sushi and do those kinds of things to become, not to become the culture, but to learn and feel like I understand where they're coming from, or at least trying to. I may never understand where they're coming from directly, and that's okay. But really, putting yourself in the seat of where you're trying to work so that you can think about where to start and where the largest impact will be from the work that you start with.
Didn't you also share the sushi with people?
Yeah. And then Maravik later was like, no, this is what this is.
So I guess the question is figure out what kind of a hummingbird you are, right? So what is it that you can contribute? I do know in Washington, we do have a tech company who does scale. Anytime there's a declaration of emergency, they scale a team of employees to directly be able to respond to government and support that, right? So that is something very unique that they do anytime there's any type of emergency. They immediately offer assistance around that. But also, I would say if you really want a challenge, consider working in trying to address some of these social issues that are very complex, because they are challenges. Because it's just, like I said, it's not a linear solution. They are factors. So one of the things you can consider is if you have an idea, like we're always open to ideas and working with someone to develop some sort of solution, right? I'm all about how can I create a solution that's going to help people. There's nothing that we gain as a public sector from it, right? So I do a lot of work with tech, like developing tools that they would want to develop. Does it work? So, and I think for any builder, any leader, or any company, I think one of the things you could do is just like, how do I start small around this? What is the topic that we want to address, and how do we maybe devote 5-10% of time to address these issues? What does that look like for you? What does it look like to have employees be able to spend time addressing an issue like food insecurity? So I think those are all things that you can go back and look. If you have no, you can always go back and consider. If you have no idea how to do that, I can always give you ideas of how to do that. But I also think the things that you do as you develop tools is the same thing that I do as a leader. Like, I know what I know, I don't know what I don't know. And so part of this is whatever you build, or who and how are you having people check your blind spots? We all have blind spots. Mm-hmm. So one of the things that I do is I bring community directly into what I do. And is this the right idea? Am I thinking about this in the right frame? And they'll be like, no, or yeah, but, or maybe this is something else. So I always do a check of whatever you build and whoever you're building for, how are you bringing them in to design and give you feedback that tool is the right tool and what it's going to work. Because I think if we go back to the letter, right, we thought all these great tools, but the 70-year-old lady, like, she just needed to call someone, right? So sometimes you have to think of the blind spot. So I think that's the other thing that you can also consider.
Gotcha, yeah. All right, so then tactically, like very tactically, what do people need to keep in mind? If they want to work with government, if they want to work with you, Liz, what should they do and not do?
Since we're friends, I think it's great that you want to sell me a product, but a lot of people want to sell me a product. I want to know how I can change the world, right? Tell me how I can do that. And I think what Betsy said is something very, I've worked a lot of scales of government. But you're right, like when I was in Texas, the type of data that we had in Texas is not the same type of data that we have in Washington State. So a lot of times people say, well, I've done this solution here, and yeah, but it's not, it could be apples and oranges, or it could be the groups that I have this issue with they don't have they don't have a grocery store nearby, they don't have a hospital nearby. Their nearest hospital is like an hour away. And in some parts of Washington, that's reality, right? Maybe a few hours away. So I think it's one of the things is tactically think about what is it you're trying to do. And I would say, like anything that you do, is who is your audience and what are you trying to do, and learn a little bit about what we're trying to do, and then try to align with the missions and the values of the goals of that organization.
Yeah. Betsy, I feel like you have a similar opinion on this from working inside the private sector.
Yeah, I mean, in my, being in private sector, no one's going to lie to you and say that we are not for profit. We're not. We are a for-profit company, and for-profit companies want the bottom line. And so, for me, I'm very similar to you. I find a way to get to yes, and that yes is usually what will it do to the company's bottom line? Let me tell you the right story so that you understand the impact that we'll have, not from the humanitarian perspective, that's me, I'll feel good, but why will Amazon or whoever benefit from the work that we're doing here? And then, find the other hummingbirds that are willing to, I have reached across Amazon to figure out how many other hummingbirds there are out there to help tackle food insecurity with me, and they're there. And what that also does is it provides you an avenue to add to that story of, all right, well, if we do this, then this will happen. This will be the impact. This is how many more households we'll touch, et cetera, et cetera. Come with the data, but understand also that there's humans behind that data. And so we don't want to just blanket statement, come up with a solution based on data. We want to understand the humans behind that as well.
Yes. And so to close us out, we're going to end with questions, but before we do, have one more story about the individual humans that the work that Washington has done has an impact on. I was just going to describe it to you.
So we are here to get my son, Austin, vaccinated. He turned 5 today, so we've been very excited, and this is like one of the things that you're trying to explain to him how lucky he is that he gets to have this. And there's a lot of people that would love to be able to have this, and they can't, so we're excited.
It's all right. The vaccination shot is just a little pinch.
You got it.
And pinches feel a little bad, but this one does not hurt at all.
How did that feel?
Great.
Was it just more like you kind of got a little nervous, but then the actual pain wasn't a lot of pain?
Yeah.
Yeah. What I would say to people that are nervous is to go talk to the nerds, like go talk to your pediatricians, go talk to the doctors that have been looking after your kids since their birth, and let them help you in your decision.
I'm so excited I did this.
You're happy you did it? I'm glad you did it. I'm proud of you.
Thank you.
All right, we're at time. Thank you so much, everybody, for joining us.
Yeah, thank you. Thank you.